Kathleen Sebelius back in the hot seat, finally admitting there were flaws with the Obamacare rollout. Really?
Knowing what you know today, you would have started the launch October 1st?
I would have probably done a slower launch, maybe with fewer people, and done some additional beta testing, which is part of what has happened, frankly, in the early months of the launch.
I think the launch was plenty slow. The HHS secretary also answered questions about the botched rollout and low enrollment numbers, but did she leave us with more questions than answers? Joining us right now is the House Oversight Committee Chairman, Issa. Chairman, did you learn anything yesterday?
Well, I did. I learned that when you really completely blow something and strike out, you say, geez, I'd like to have gotten an opportunity to reconsider swinging at that ball. The fact is that Kathleen Sebelius is not providing America the truth. As a matter of fact, in a letter that I sent to her, I warned her that her people are actually obstructing justice. They're telling individual companies who have serious reports on security flaws, in other words, vulnerability to hackers, not to provide us the information. And what's amazing about it, Brian, is they're saying 73 days later, don't provide information because it's a roadmap to hackers. Well, that means the vulnerabilities are still there today. Your personal information likely can be hacked on these websites today based on their refusal to let us see what was, in fact, pre-launch vulnerabilities.
It's unbelievable. Security, that's a nonpartisan issue. Everybody understands it. We've all been affected by it. When you got someone like Chairman Rogers coming out saying, my cybersecurity experts say we're very vulnerable, who's going to put their tax information in? Now, today at 9:30 Eastern Time, you're taking action. What's happening?
We're hearing first up from 3 medical doctors who will tell specific examples of how, under the current law, the Affordable Care Act is interfering with their ability to continue treating their patients. And it's the tip of the iceberg, because the direct impact that you're going to hear about today is second to the indirect impact, which is medical insurance companies are dropping all kinds of doctors, creating, if you will, voids for oncologists and other areas around the country. And in fact, quite frankly, this is exactly what you could expect when government takes over and starts mandating. The private sector will figure out how to benefit, gain, whatever you want to call it, from it. And that's exactly what we didn't want, is we didn't want a government takeover of health care, but that's what we're getting.
Well, so far you have an orthopedic surgeon, you have an ophthalmologist, you have a neurologist. So you got people out here who have been directly affected. What's your answer to those who are saying on the left, well, he's just going to cherry pick people who don't like Obamacare?
Well, that's a good thing. We have a system in which the Democrats get to pick a witness. They've picked an intellectual. At the last hearing, they picked a health historian who told us that penicillin was developed by the government in World War II. Unfortunately, it was developed in the 20s in Scotland. But the fact is, there are benefits to spending $1 trillion of your money on people's health care. No question at all. Our question really is, are we driving down the cost of health care while maintaining the availability and benefits we had before the law? And the answer clearly is no. This is a $1 trillion mistake. It's one in which, yes, some people benefit from all that money, but a lot more people are being hurt. 5 million people have lost access to the health care they wanted, and more will lose. Well, only a fraction of that are getting access to these subsidized systems.
And real quick, Chairman, a lot of people say health care costs are flat. They have not been increasing at the same rate, so it shows Obamacare is working. What do you say?
Well, ultimately, health care is a combination of good quality and a price. And since 1960, when the government really began interfering in the health care system, 63 and so on with Medicare, we've gone from 5% of all our money, 5% of GDP, to nearly 18% of GDP spent on health care. So the fact is that we have a long history of spending more and not getting that much more for it. And that's what needs to be changed. We need to start getting doctors and hospitals to be more efficient if we're going to maintain good health care at a reasonable price.
But over your shoulders, so the action will be taking place at 9:30. The hearings begin with the chairman leading the way with the House Oversight Committee on Obamacare's impact on premiums and provider networks. Chairman, always good to see you. Thanks for joining us.